As Canada has been caught up in this elbows up approach to countering Donald Trump's tariff threats, we've been talking a lot about barriers to interprovincial trade and a determination by both the federal government and the provinces to bring down some of these barriers to better allow companies to get their products in to other provinces right across the nation. There is a suggestion in a piece in the Gazette today that we should be looking at this not only for trade, but also dropping interprovincial barriers to healthcare. And here to explain the thinking behind this is Louise Binder, lawyer and health advocate with the Save Your Skin Foundation. Louise, thanks for joining us on CJAD.
Thank you for the invitation.
So when you write, along with Kathleen Bernard, about the patchwork approach we have across Canada to certain aspects of healthcare, what are you focusing on?
So I'm focusing particularly on the access to public drug reimbursement systems across the country. You know, we're promised under the Canada Health Act that all residents will have medically necessary services equally and that they'll have reasonable access without financial and other barriers. But in practice, nothing could be farther from the truth in Canada.
So describe for us, for example, some of the differences from province to province to province when it comes to that aspect of healthcare.
Sure. So each province makes its own decisions about which drugs it wishes to reimburse publicly. And the decisions are not the same across the country, province to province, which is very serious for patients, especially for patients with life-threatening and serious illnesses, including cancer. So just as an example, Western provinces pay for take-home cancer medications, but Ontario and the Atlantic do not. So how does that make sense if we're all living in Canada and we're all supposed to get equal access to these services?
No, it doesn't make very much sense. And it also raises the prospects that of some person having to move provinces to get adequate health care, which seems a little nutty.
Well, we've heard certainly cases of people who move provinces, people who have to go to other provinces to find doctors who will treat them. And in a lot of cases, people don't get treatment at all because they cannot afford the cost of this travel to other provinces. And they may even have to pay for not only hotels and meals and travel, childcare, but even for the drugs themselves. So we know that 20% of cancer costs are paid by people out of pocket and not by the government.
Quebec and the other provinces too, I'm not going to say it's just a Quebec thing. Provinces in general are very territorial about their jurisdictions. And Quebec has its own prescription drug plan, drug insurance plan. If you're not covered through a work plan or by a spouse or partner's work plan, you buy the one that the province offers at, you fill out the forms at tax time and that type of thing. How can you convince provinces that have kind of gone their own way on this question that they should unify? Is there any benefit to the aside from the benefit to patients, is there any benefit to the territorial provinces that want to, be masters of their own domain?
Well, I'm not suggesting that there be one huge pot of money that goes across the country. I think the provinces and the federal government are going to have to get together and figure out actually how we do this. But, it's actually even a barrier to trade in this country, because if companies can't sell their products, they're not going to come and do research and development and come into our country and bring us jobs and improve our economy. So it's not just a question of patience, although for me that would be enough.
Would there be an added cost, do you think, to the provinces to have this unified approach?
In some places, there very well might be. I mean, cancer drugs, new innovative cancer drugs, are not without their costs. However, if you keep people out of out of hospitals, and you keep them out of doctors' offices, and you keep them at home, you definitely will. Over time, the costs will go down in your healthcare spending in other areas of the healthcare budget rather than drugs.
Has your group done any analysis that compares the provinces? I'm just wondering where Quebec stacks up in terms of how generous its program is.
Well, I spoke to actually two of my cancer colleagues in Quebec before this call, and they tell me that certainly Quebec they consider to be better than a number of the other provinces, but certainly there's always room for improvement.
Would you say that this is a matter of life and death for some Canadians?
It is definitely a matter of life and death for some Canadians. Definitely. If they can't get the drugs they need, and they can't afford to go where the drugs that they need are available, then they have no choice but to either skip doses of their medications, not take those medications at all, or go without food and adequate shelter and other necessities. And one way or another, that is shortening people's lives.
How is your group applying pressure to government to get together on this, to at least get together to discuss it? The provinces and the Fed seem to be talking a lot these days. Maybe they could devote some time during one of their Zoom meetings.
Well, absolutely. I mean, if you can break down the barriers of tariffs, you can break down the barriers of drug reimbursement systems that aren't adequate for people across this country to get what they need. The Canada Health Act has promised us that, and it's not delivering. So we have been going province to province and to the federal government talking about this issue with all of them to see if we can't get them to come to the table collectively and resolve this problem.
Louise Binder, thank you very much for your time.
Thank you.